The COVID surge has put Michigan back among the top 10 states with the highest number of cases. Good evening to you. Welcome to 7 Action News at 6. I'm Carolyn Clifford.
And I'm Dave LEWALLEN. What's being called a 3-week pause, now in effect, is aimed at slowing the spread. The pandemic order from the Whitmer administration's health department has a wide-reach shutdown certain businesses and in-person learning at many schools.
It comes as the state reports almost 5,800 new cases tonight. Michigan ranks 6th in the nation for the highest number of cases within the last 7 days. The state has also climbed to 5th in terms of deaths, with 62 more loved ones lost since just yesterday.
7 Action News reporter Kim Russell has been talking to frontline workers. She joins us live from Beaumont Hospital in Royal Oak. So, Kim, what are they up against here?
You know what? The people who are working to protect us from COVID-19 are seeing the problems. For example, case investigators and contact tracers, they simply can't keep up with all of the cases. Doctors, they're seeing more patients hospitalized, and they are preparing for it to get worse. The Michigan Department of Health and Human Services says the current number of deaths from COVID-19 is over 4 times the amount of deaths in October. The number of people hospitalized with COVID-19 statewide increased 33% week over week as new COVID-19 cases continue to increase at an exponential rate throughout Michigan.
Really, right now, we're all trying to prepare because we know a week or two down the road, you're going to see that surge of patients coming into the hospital.
Dr. Justin SKRZYNSKI is an internal medicine physician at Beaumont Royal Oak. He says doctors have learned a lot and COVID-19 survival rates have improved, but current survival rates are not guaranteed.
We know that we can get better outcomes for these people. The problem is, though, again, if you have this giant wave of patients coming in that overwhelms our ability to take care of them, we're not going to be able to get those outcomes necessarily.
If someone has a positive diagnosis, we're hoping even before they get a call from the health department that they can put themselves in isolation and start notifying their contacts themselves.
Kate Guzman is Administrator of Medical Services for the Oakland County Health Division. She says they need the community to be proactive. She says case investigators and contact tracers are having to do triage and work cases that most likely impact the most vulnerable first.
We're pulling out positive cases, diagnoses over the age of 65, 18 and under, so that's the school age, really focusing on the schools, school employees, long-term care residents, long-term care staff, hospital staff.
As people make Thanksgiving plans, Dr. SKRZYNSKI says he knows what he will be doing.
And I'll be at the hospital on Thanksgiving Day, so I'll be taking care of people on that day.
He says with the data we are seeing, the rational question people should be asking is not whether they want to eat turkey with family, but whether they want everyone to survive for future holidays.
If we see the same kind of super spreader events for Thanksgiving, we know that we're going to have people that are going to die of this disease before Christmas rolls around.
And one thing to keep in mind, a lot of people who are contacted by contact tracers, they actually say even if they've been diagnosed with COVID-19, they can't isolate, they can't quarantine, and contact tracers help them get resources so that they can pay their bills, have food, have their medicine. So right now, with contact tracers not being able to reach all of them as a community, if you know someone who's sick, we all need to reach out and help where we can. Reporting live, Kim Russell, 7 Action News.
We all have to do our part to get through this together. You're so right. Thank you so much, Kim, for the live report.